Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today we are checking in with Michelle Davey. She is the co-founder and CEO of Wheel. They just raised $150 million Series C round, co-led by Lightspeed Venture Partners and Tiger Global, one of my favorites. They provide a white label telehealth solution that helps healthcare organizations bypass the $15 million in 15 months it takes to stand up a virtual care solution. So Michelle, this is like such a market validating fundraise. I cannot wait to get into this with you.
Yeah, absolutely. So excited to chat, Jessica. It was only 9 months ago when we were talking last time, from the last time that we raised. So really excited to jump in and kind of all of the growth and where we're going now.
Oh my gosh, I have lots of questions about the growth, but before we get to that, let's talk about the fundraise real quick. Shout out the investors in this round. I mean, because you've not only attracted the attention of Lightspeed and Tiger, who have great pedigrees in this health tech space, but also Cotu's in there, Salesforce is in there, some existing investors are back. So talk to us about the round real quick. Get us up to speed.
Yeah, absolutely. Well, first, we're really excited to welcome back Lightspeed as a lead. They've been a phenomenal partner for Wheel and excited to have them back. And when we were thinking about this round and really what the purpose of the round and the types of investors we wanted, it's really about the long game here, Jessica. We're thinking about how does Wheel scale and get into the hands of millions of patients and clients and our clinicians. So we are excited to welcome Tiger into the Wheel family. Again, that longevity and kind of a lot that they're doing in the healthcare space. Then Cotu and Salesforce, kind of new entrants into healthcare, but really excited for them as well. And then all of our existing investors came back in, really a testament to what we're building and continuing to see.
All right, let's get into what we're building here, because this is just one of the most unique models I think that's out there as far as virtual care is concerned. So you guys are behind the scene, white labeled, and you're selling to what you say is the next generation healthcare companies, and you're having some great success at this. So I want to hear about the growth, because the growth was great last time I talked to you, as you alluded to 9 months ago when you guys closed your B. And at that point, you guys were at like 300% year over year growth. What I've read now in this new release about the funding, 1.3 million patient visits last year, expecting it to triple this year, and you've expanded your client portfolio 100%. Talk to me about that client portfolio. And I know you're not going to name names because you never do, but categories of those clients seem to be growing. So not only just those next gen companies like the digital health companies or the online virtual pharmacy companies, but also I'm seeing traditional healthcare providers appear for the first time in the list of clients. So tell us about that.
Yeah, absolutely. I think it's really a testament to the market and what's happening in virtual care. So we're seeing everything from traditional healthcare providers like hospital systems and the payers all rushing towards virtual first care. We see large retailers, both in healthcare and outside of healthcare, coming in, as well as digital health, our beachhead market, where there's $29 billion in funding last year. And they're all racing to the same direction, to serve patients virtually. And they all need the underlying clinical infrastructure and clinicians to deliver that care. And that's where Wheel comes in. So we have a large list of clients. I'm not going to tell you who they are, but again, it is from the digital health to everybody from large diagnostics and lab leaders to traditional healthcare providers for the first time. And then also moving into more of kind of the payers and health insurances, we're helping them come in and deliver virtual first care.
That's also new. Can you tell me, I know you're not going to name names. We've arrived at that conclusion, but can you give us a sense of like, among those categories, are like one or two of them really driving the demand upward for your business, like for these virtual services that they want to plug in?
As I mentioned, we're really seeing a rush of all of these different categories coming in. They're all coming and they're all going towards the same destination. How do we serve patients virtually? No matter if it's in primary care, urgent care, longitudinal care, behavioral health, they're all trying to build cohesive and comprehensive care platforms for their patients. And really, that's the backbone of Wheel. That's why we were built. We were built to be that underlying infrastructure and then have that entire workforce that works behind the scenes, fully white labeled from the software all the way to the clinicians to deliver that care under their brand. So while there's not one type of client that's powering all of that, it's really that aggregation of all of these different clients serving patients across the US.
And I mean, I know just from other things that I've been reading about in the industry, other conversations that I've had with other virtual care companies, the pandemic obviously helping kind of, tick up that demand for these types of services, especially among like some of these providers who have not gone virtual before. Do you have any concerns about demand as like the pandemic starts to wane and people start to go back to, more of the traditional in-person care delivery? Any concerns about what that's going to do for demand for Wheel on that institutional client side?
Well, I think what we've all seen since the pandemic and even continuing post-pandemic is that more care is starting online than ever. Maybe it's not ending there, but it's starting virtually. So if we can help a patient virtually through the care continuum, we are, and we have to build that infrastructure to do so. So telehealth, labs, remote patient monitoring, pharmacy where necessary. But maybe that care starts online and we triage from the beginning, and maybe they do need to go in person. And so how are we building the care pathways and the referral pathways within the same infrastructure to make sure that those patients are getting the care that they need and getting the referral to in-person care that they need as well? And so we are thinking and building that. I still believe strongly that in the next 5 years, most, if not all care will start virtually.
Okay, well, we've got it on camera now, Michelle, so we're gonna have to check back in 5 years and see how this all nets out. So I wanna ask though about, in addition to like that post-pandemic, like what's gonna happen next? I mean, I do feel like you're onto something here in the sense that it's like, I keep hearing the word omnichannel being like laid out there by all manner of folks who are trying to figure out what to do next with their care. So it's like, if there was early pandemic panic about let's hurry up and stand up a virtual care something so that we can just reach our patients. If you were a plan or a provider or even a digital health company or a pharmacy, now it's like, it seems like things are becoming a little bit more strategic, and omnichannel has been applied as the label as these institutions are trying to figure out, okay, how do we make the most out of what we've already invested in? And I even think like from what I've read about Wheel and how you guys have evolved, you're even doing some omnichannel stuff yourself. So talk to me a little bit about some of the tech that you've added to do better triaging or patient routing or clinician matching, because I think that that's a unique feature that seems to have been bolted on since the last time I spoke with you.
Well, we've always had the matching technology where we're making sure that the patients are getting access to the right clinician at the right time. That is the core fundamental and the mission behind Wheel, right? Expanding access and not just from a geographic and socioeconomic perspective, but the right care from the right clinician. That is incredibly important. And that's why we're building kind of an omni-channel approach. And so from a tech side, like I mentioned, from the earliest days, most people saw telehealth as urgent care, right? That was predominantly where it was. But since the pandemic, we've really been able to expand the types of care that's being treated online. So urgent care to primary care to longitudinal care for chronic conditions. And some of that care needs to not just be delivered virtually. Sometimes that means a referral to in-person. Sometimes it means maybe you don't need to seek actual care or a prescription. It's just education. And so it's not only the underlying technology, the infrastructure that is being built here at Wheel to power that, but also the right types of care providers. So you can imagine if you're coming online as a patient for the first time, historically in healthcare, in virtual care, you're getting matched with the doctor, maybe a nurse practitioner. But you can imagine some of that triage can be brought in through different care coordination and care providers, both through tech and through actual human beings and clinicians. And so not only have we developed the tech, but we brought new providers and clinicians online, like nurses, to help with that triage and help really expand the capabilities and what people can build on top of Wheel, which we're really excited to do. And in this omni-channel approach that we are all talking about, it really is with the validation that a market has come online for the first time really ever. And now what we're enabling is people to build customized care pathways for their patients, whether that's virtually or in person or a mix of two, and that hybrid approach that we've all been talking about.
We've got some fierce competition in this space, or at least it seems that way. I mean, I look at Amwell, I look at Teladoc, they've been around for a long time, trusted brands in this space. I know how you guys are differentiated in some ways from the way that those two companies are tackling this task of helping provide that virtual care infrastructure. But you tell me, I mean, how do you see yourself as differentiated from the big guys, the legacy companies that are out there?
I think first and foremost, the most obvious one is we are truly a back-end provider. We do not have a patient front door. So a patient can't come onto the Wheel website and see a Wheel clinician. We are fully branded all the way, again, from the software, all the way through the clinicians under our client's brand of care. And that's incredibly important because it builds trust, not only with the patient, but also with our partners. We've really built a symbiotic relationship. So as we grow, they grow, as they grow, we grow. It really enables us to build with the right things in mind, right? We're really focused on the clinician and the infrastructure to get that workforce behind the scenes, powering all of that care and that high quality care that's being delivered, while our partners are primarily focused on the patients, their journey throughout it, which creates a really nice relationship. So that's one of the ways. I would say the other one is we are really focused on the clinician. So we are focusing on how do they evolve and work in virtual care, because pre-pandemic, even though it feels like a lifetime, it's not that far in the past that they essentially came online for the first time ever. And so we are helping them train and educate in how to deliver that care in a high quality manner.
In that traditional healthcare provider space, you know, and this is one of those things that I often hear about Wheel. It's like, you guys are so focused on your clinicians, and I want to get to what that means in a second. But before we get there, I do want to ask, you know, like, what is the value prop then to those traditional healthcare providers who are like, I mean, they're listed new again in that category of clients that you guys are working with now. I'm curious to hear how they adapt to that messaging when oftentimes they see the docs in their network as the real differentiator for them. How's that going?
Well, I think first and foremost, it is like, it's no longer a secret that the workforce is key and a component to delivering care. And in fact, the pandemic highlighted that. So in traditional healthcare, I think right now we're seeing a large great resignation happening. And so more than ever are these providers coming online and trying to find solutions to their already gaps that they may have in care. And Wheel is a great way to do that, all under their own brand. So it doesn't feel like a different brand towards that patient, which is incredibly important because, again, it builds that trust. I use the analogy of like, as you're a consumer and you go online and you're online and buying something and it redirects you to a different website, you're like, wait a minute, where am I going? And most of the time, you're not going to enter your credit card information. You're not going to really believe that that is actually the person who they say they are. And in healthcare, trust is so inherent and so important, you know, and so that's really the messaging and the reason why that these traditional healthcare providers are coming with Wheel. I would also say the other big piece is we have built tech for the next generation of care. We are building for asynchronous, synchronous, triage, and how all of that works together versus piecemeal, fragmented infrastructure that historically has been trying to kind of be cobbled together and then hoping that the clinicians and the patients have a great experience from that. We all know that doesn't work.
No, I think we've all experienced that, especially at one point or another in the last 2 years. No, I think that's so interesting to me. And I like it. It is. You guys were founded in 2018. And I think oftentimes that because of the success you've had, the money you've raised, like I forget that, like you're only a couple years old. And so it's like, you've been able to leap over like a decade's worth of like trying this out, patching it together, figuring out where the bugs are at, and really offering something that's different and kind of like full service turnkey from the get-go. I think that's really interesting. I want to talk a little bit more about that clinician education side here, because it's interesting to hear you talk about this, particularly in that context of the traditional healthcare provider, because it's like, I imagine like, okay, great. They can still use their own docs, have their own competitive advantage, but where they need to fill in a gap or a blank or a time slot, they've got a Wheel clinician who's been purposefully trained to deliver care virtually. And this purposefully trained piece of what you guys offer, I think is really unique. And I even saw that part of your funding is being directed to expanding your onboarding process for clinicians and also the education that you're providing them to deliver care in this online environment. What don't people get about how different it is for a clinician to deliver care virtually? Like, what are we missing about this, where it's like, no, we need to be educating them on this new way of delivering care?
Absolutely. I mean, this is something that's been a foundational part of Wheel since the very beginning. As you mentioned, we've been around since 2018. So we were really enabling providers to come online for the first time ever early in their career. And I think now, since the pandemic, we're seeing different types of clinicians come online. And that's exciting. That's great. But as you can imagine, put yourself in the shoes of a clinician today. You're coming on, there's 700 different companies to work for. Maybe you've seen a patient through your Zoom, or something, you stood up in the middle of a pandemic.
Something HIPAA compliance, Michelle, something HIPAA compliance.
Yeah, HIPAA compliant, doxy.me.
There you go.
And, they're really looking at how do they extend their practice, not just how do I see a patient and triage them up front and hopefully get them back into an office, but how do I fully take care of a patient where they're at? And what we have built essentially is that one place to go. Come on with Wheel. You can manage your practice, one schedule, one credentialing effort. And then we have all of the education to support you through that journey. So maybe you're a family medicine nurse practitioner who's trained predominantly in women's health. That's amazing. We have a lot of opportunities for you, but we can also help you extend your practice into, maybe that's pediatrics that you want to see more of, and that education and training, so that the clinicians who are on our platform are ready to go and they're serving the highest quality of care possible. So not just during the onboarding phases, but we've also built just-in-time training inside of the platform, so you don't also have to remember all of this while you're treating a patient. The technology can do a lot for them in that moment. And that's why we talk about building D2C, or direct to clinician, here at Wheel. We're really focused in asking them, how do we improve your experience? And education and training is the number one thing that we hear is a positive of Wheel, and why clinicians keep coming back.
90% retention rate 2 years in a row. And this last year, that's just like nothing shy of remarkable to me, like particularly due to the great flight of healthcare professionals from like all manner of healthcare businesses, or like everybody's become a travel nurse now because it paid so well. So I mean, like, that's pretty remarkable.
Absolutely.
Okay, last thing for you, Michelle, I want to wrap up I want to bring it full circle and talk back about the funding, but this time I want to talk about what the funding is going to be used for. And one of the things that caught my eye in the release about the funding is this whole thing called diagnostic services. So what does diagnostic services mean? Because my crazy imagination here gets me into all sorts of other different types of health tech startups that either deploy people to people's homes to do testing, or mail kit testing, or what does this mean? Tell us, diagnostic services.
Well, we're really excited. Like I said, we're continuing to build the underlying infrastructure to power virtual care. So moving from just telehealth and different care modalities under telehealth to also diagnostics and lab services, which we're excited to continue building on top of that, and also remote patient monitoring. Let's not forget that we're seeing a lot of wearables and RPM coming to the space. All of this designed on how do we get the right data into the hands of clinicians to make the right treatment plans for these patients and get them on their way to being happy and healthy again. And that's really the core. So we're building a lot more around that, which I'm excited to talk to you about in another date. But that is a tease on kind of where we're going, but there's a lot happening under the scenes here at Wheel.
All right. Well, I love that. So now we have to have you back on to tell us more about how you're spending your $216 million total that you guys have raised so far. We're so excited to see that this model is getting validation in the market, Michelle. I mean, truly, it's really exciting. And I think when you and I first met and we first spoke, it's just the company has come so far so fast, and it's really exciting to see that people are really looking at the differentiated way that you're building out virtual care and embracing it and plugging it right into what they've got going on. I think it's so cool.
Awesome. Well, thank you so much. Yes, the validation has been amazing, and we're excited to continue our growth. There's a lot more coming.
I can't wait to find out what. All right, folks, that's Michelle Davey. She's the CEO and co-founder of Wheel. We're here chatting about her $150 million Series C, which she just closed. And you heard all of the goodness about where that money is going to be put and how the company is poised for growth. Check back in with me for more interviews with the who's who of health tech over there on my YouTube channel. It is youtube.com/WTF Health. Or you can visit my website, www.wtf.health, and sign up for my email newsletter, and I'll deliver these great little interviews right to your inbox. Michelle, thank you again for joining us. It's always a pleasure to catch up. Congrats on the round.
Thank you.
All right, we'll talk to you soon. Bye.
Bye-bye.